Hello and welcome. This is Dr. Jerry Cuomo. I'm here with another rescue case. This one is a Straumann bone level, regular platform, or we call an RC, regular CrossFit. It's in a tooth number 19 position. As you can see, it's a gold crown. There has been prior access by two operators, one a periodontist, one a general dentist. Turn a little bit toward me. You can see the mobility involved here. It does have some rotation. There were two access holes that were made by the previous dentist, one of which is more lingual, the other one is more buccal. I have instruction to go through the buccal. To remove the crown and the abutment, there's a fractured screw underneath the other screw that was placed. And so our job today is to go and get that screw out. The other thing that we have to concern ourselves is the mobility. We'd like to stabilize that first, as we always do when we're rescuing cases. So once the crown is out, the abutment's out, and the first screw, we'll start to look at the fragment and any other internal issues that may have occurred during the patient's rescue attempt at the other dental office. Saliva ejector. Okay, so we'll take that out. It's already pulling. That's for you. All right. There we go. Very good. All right, let's take a look. So I'm going to push down. Let me know if there's any pain, any discomfort at all. None really. Okay. So while I'm holding it in place, we're going to bond some composite to that. One other thing I want to mention in the video also, we have an upper inlay that's been out, and that is going to be replaced by a filling today. So that will happen later on. We'll do a recording of that as well. All right, here we go. We don't really know the cause right now of the screw, the fracture. We're looking into that. Two by two gauze, cotton pliers. All right, so X-ray doesn't really show us perfectly, but we will probably take another X-ray after the crown is removed. We might be able to see some more information, gather more information. That's the key. This is quite exploratory. All right. I'll start on the buccal side first. I'm going to put some cotton down. I'll have the patient turn toward me, holding it down. I'll go ahead and place some of the blue block out. We'll dry them off first. Light goes down, please. It's just the first part. I'm going to push down with the bonding light and then cure it. Next step is we're going to add to the lingual. Alright, so I'm going to remove this. come over here on the lingual aspect. Pamela, you're going to hold the lip out of the way and the cheek. All right. Continue to hold. Thank you. Okay. Curing it. Now we'll add to this. Key is if you don't stabilize, of course, everything starts to rotate, and you can cause issues, cause problems. So minimizing problems, stabilization. Okay, now we're going to add to that. Cure it. All right. We'll get all that saliva in a minute. All right, you doing okay? Okay. All right. Okay, now I'm going to just check the material. I have it. All right, very good. Let's turn that off. There we go. Suction ready, please. Thank you. All right, now we're in on it. This is all a temporary material, probably cavet. We'll go in with a slow speed. Other attachment, thank you. Right here, okay, burr block. Okay, now we're just going to slowly remove the excess. There should be Teflon underneath as reported by the dentist. Try not to touch the crown. Thank you. And a little water from a dental assistant. Here we go. I'll wait. Again, please. All right. Notice there's lots of food in there. Looks like green leafy vegetables your mother was trying to make you eat, and you got it all in there. All right, very good. And there's the Teflon tape. It's very strongly placed. I'm going to come in now with a scaler and finding out that that's pretty strong, whatever that is in there. Looks like composite was placed. So another surprise, composite was placed over on top. Okay, another surprise, not really documented before, and we have to reinforce our bonding. So the light goes down again. Okay. We're drying first, retracting again. All right. Triangle. Okay. running late. So now we know that there's now composite that we have to go through that wasn't mentioned in the initial report by the referring dentist. I'm going to add a little bit more. No problem getting through that. We'll just have to use a slow carbide burr. Let's connect the dots here. Adding to the stabilization is key. We'll offer a new triangle next. Alright. There we go, nice and stable. Test the stability. Perfect. Change out. Alright. Need the burr block, please. So I'm going to take a smaller quarter round. Let's see if we can get this cleared up in here. Again, we're looking for Teflon. That was reported. That was used to cover the screw head. Little light air now. Follow me with air. Thank you. That's a composite to go through. Little vibration coming here, bud. You all right? There we go. Some form of a cement was used. I'm reporting some form of cement. On top of the, looks like cotton underneath. Let's see what was used, actually used. They reported Teflon. I'm not really feeling a lot of Teflon. That's the composite or some kind of a cement resin. And that requires a little air, please. Okay, now we're removing the remnants of the resin, cement, or composite, whatever was used on top of the next layer, which still needs to be identified. Either it's cotton or it's some form of Teflon, as reported. Looks like cotton to me. Continue to report as I remove it. Here it comes. It is definitely Teflon. I will go to the cotton pliers. Try to pull that out. There it comes. Now we'll just take a look inside. No air, no water. Just going to look straight in now that the plug is out. There's the basal screw, but we see there's still more interference. I'm going to remove composite. Dental assistant has her suction ready. We'll use a scaler. So we're looking straight at the basal, the head of the basal screw. It is a Straumann screw, but there's this heavy composite. I just dislodged it. Here we go. Microsuction tip, large. Thank you. So we're going to go with the large tip because we don't want to push that down any further than what it is. We want to get it to come straight out. So there's our large tip. Grab a hold of that. Let's see if we can have it come straight out. Alright. I have a surgical suction tip, white. Got it. Alright, now we have access. Let's go get that screw out. We'll use a regular driver. Alright. That much mobility in there. This should come out with just hand untightening by hand. Make sure the driver's seated fully. And we'll back out the screw. Nice and easy. Alright. Screws loose. Now we bring back in our scaler, and now we're going to slowly remove all this reinforcement, and the crown should come right out with it. Alright, straight up. Huh. Why wouldn't that want to come up? The screw is loose. Okay. So we will pre-soak it. We're going to use our tartar and stain, saliva ejector, thank you. Any bad taste, let me know. Any feeling, let me know, okay? Okay. I'll try to dissolve any deposits around the screw. That could help us dislodge this. Some other factors involved could be this contact holding the crown in. They may have placed some bonded resin around that, so we might have to go in there next. We don't know. Okay, now we'll take our micro suction tip. The large one is okay. Actually, no, I'm going to take the small tip. I don't want to suck down the screw if it's loose. All right. Okay. Now I'm going to use a long endo explorer. Transfer. Napkin, please. Not a tissue. Okay. I'll just keep one right here. Okay, let's see. I'm going to go down. Let's just see if we see any movement. Yep. So we saw the movement in the screw itself. That's good news. So something else is holding everything in. I'm surprised to see cement was used here. Okay, so I did see the movement. Now let's reinsert the driver gently. See if that will continue to move. It is. See if it backs out. Okay, I'm going to ask my dental assistant, let's go with the next size up for suction. Okay, microsuction, next size up. So we're not going to go too large, but we want to go large enough so we can get this out. You know what, this will be fine. This one's actually really good. All right. Back inside, let's see if the screw comes out. Lock on. No. Oh. It's being held in place. That's interesting. Normally this would come straight out. We notice the head of the screw is not stripped, but it also is not mobile. So we'll continue to pre-soak. You okay? Nothing bad tasting, everything's still good? Oh, this is odd. Okay, so I think I understand what's going on. So that first screw doesn't engage, but the next fragment is the part that does. So we've got to get this out. Let's see if it'll come out. It did. I got it. So we got the screw out, but that's the first one. The second one is holding the crown in place. And you could see on this, can I have the light up? If it's not up already, if it's up already, that's fine. It's all the way up, okay. So if you look real close, you can see this is a basal screw, but there's some abrasion that occurred on the tip of the screw itself. So this one will be just exhibited right now. We'll just put it in a safe place, but not to be thrown away. Here we go. So that is identified as a basal screw. Now we know what's going on. So the other fragment is what's holding the crown in, and that's why it's still loose. So let me ask the patient, has the crown ever come out in the hand, or was it always just loose in the mouth?
It has been actually taken out by other dentists, but it hasn't ever come out on its own.
Okay, so it's always just been a loose crown after the screw was fractured.
Yes, but it hasn't.
But it's never come out. Ah, now I understand. Now I get it. Okay, good. Okay. So now we're going to pre-soak that. And we got to look all the way down in there. Honestly, I think probably what I need to do now is to secure the crown again. So we're going to do that. I think I'm going to use a rubber dam for this. All right. So you can rest a little bit. Actually, I'm going to rinse you out thoroughly. And then we're going to get a rubber dam together. We'll take a little bit of a break. Dr. Jerry Cuomo with another rescue. We're going to get this guy solved today. We're going to definitely try to get it solved. We're going to find out what else we got to come up against here, because now we know that there's a fractured screw, but it's holding the crown obviously in place. But it's a loose screw, so that's working in our favor. It's a matter of loosening up the fragment to get everything out. We'll be back in shortly here. Let me just click the